First aid, safety interview, question and answer. 1. What do you understand by the term first aid? First aid is the immediate care that is given to someone who is injured or in need of medical attention. It's important to understand that first aid is only a temporary solution to a problem. It's a way to stabilize a patient until they can receive more advanced medical care. I believe that first aid is a valuable skill that everyone should have. It can help you save someone's life until they can receive more advanced care. 2. Can you explain how to manage bleeding in a patient? When managing bleeding in a patient, I always make sure to assess the severity of the wound before beginning treatment. If the wound is minor, I'll clean it with water or antiseptic solution and cover it with a bandage. For more severe wounds, I'll apply pressure to the wound using gauze pads or a clean cloth. I'll continue applying pressure until the bleeding stops. 3. How would you deal with an unconscious person who is not breathing and has no pulse? I would first check for breathing by looking, listening, and feeling the chest. If there's no breathing, I would call out for help and then begin rescue breathing. I would give 2 breaths every 5 seconds until the person starts breathing on their own or medical professionals arrive. Next, I would check for a pulse at the neck and wrist. If there's no pulse, I would immediately start CPR with 30 chest compressions followed by 2 breaths. 4. If someone's choking, what are some ways that you can help them? If someone's choking, I would ask them if they know the Heimlich maneuver. If they don't, I would teach them how to do it. Then, I would have them practice on me so that they are prepared in case of an emergency. Next, I would call emergency contact number and then perform 5 back blows between their shoulder blades. After that, I would give up to 5 abdominal thrusts. 5. What should you do if someone collapses or faints suddenly? If someone collapses or faints suddenly, I would make sure they're lying on their back with their head tilted slightly back and their mouth open. Then, I would call for help and check if they have a pulse by placing 2 fingers on their neck at the spot where their Adam's apple meets their collarbone. If there's no pulse, I would immediately begin CPR. 6. What are some common first aid procedures for burns? The first thing I would do is assess the severity of the burn. If it's minor, I'd clean the wound and cover it with a bandage. For more severe burns, I would cool the area by running cold water over it or applying ice packs. Then, I would remove clothing from the affected area and wrap the burn in gauze. Finally, I would transport the patient to the nearest hospital. 7. What do you understand about the role of CPR? Cardiopulmonary resuscitation. When providing first aid, CPR is one of the most important skills for anyone working in the medical field because it can save lives. I have taken several courses on CPR over the years, including refresher courses every 2 years as required by my state. I also know when it's appropriate to use CPR and when other techniques are more suitable. 8. What are some common causes of burn injuries? Burns are caused by heat, electricity, chemicals or radiation. The most common cause of burns is scalding liquids like hot water or grease. Burns can be very serious because they damage the skin's outer layer, which protects our bodies from germs. If someone has a burn, I would immediately remove whatever is causing it. Then, I would clean the wound and cover it with gauze to protect it. 9. What are the different types of wounds that need immediate medical attention? There are 3 different types of wounds that should receive immediate medical attention. The first type is an open wound, which is when there's a break in the skin or tissue. Open wounds can lead to infection if not properly cleaned and bandaged. so I always make sure to clean them thoroughly before applying any bandages. The second type is a puncture wound, which occurs when something pierces the skin. Puncture wounds also have the potential to become infected, so I always ensure they're disinfected before being bandaged. The third type is a laceration, which is when the skin is torn by an object. 10. Why is it important to keep ice packs away from injured areas? Ice packs are very effective at reducing swelling and pain in minor injuries. However, they should never be placed on open wounds or near any sensitive body parts. I once had a patient who was suffering from a sprained ankle. He wanted to use an ice pack to reduce his swelling, but I explained to him that he could damage his ankle further if he used an ice pack. Instead, I recommended using cold water to reduce swelling. 11. How do you administer first aid to patients suffering from electric shock? First, I would assess the patient's condition by checking their pulse and breathing. If they are unconscious, I will administer CPR until help arrives or the patient regains consciousness. Next, I would remove any jewelry or clothing that may be touching the skin. Then, I would check for burns and treat them with burn ointment. Finally, I would call emergency services and wait for them to arrive. 12. What are some tips for administering CPR safely? When administering CPR, I always make sure to check my hands before starting. This ensures that they are clean and free from any cuts or abrasions. Next, I place the heel of one hand on the center of the victim's chest. Then, I place the other hand on top of the first so that both are in the middle of the chest. I then give 30 chest compressions at a rate of 100 per minute. After each set of 30, I pause for 2 breaths. 13. Is it safe to use iodine on an open wound? Iodine is actually not safe to use on open wounds because it can cause irritation. Instead, I would recommend using clean water or sterile saline solution. Both of these options are much safer than iodine. 14. When should you dial emergency contact number? I would dial emergency contact number if I saw someone who was unconscious, bleeding heavily or having seizures, if someone had an injury that required stitches, lost consciousness or was unable to move their limbs. I would also call emergency contact number if someone was experiencing chest pain, shortness of breath or other symptoms of a heart attack. I would call emergency contact number as well. 15. What should you do if you're unable to stop bleeding immediately? If I'm unable to stop bleeding immediately, I would first make sure the patient is stable by checking their vital signs and administering any necessary medication or treatment. Then, I would apply pressure to the wound for at least 5 minutes before releasing it to check if the bleeding has stopped. If not, I would reapply pressure for another 5 minutes. If there's still no improvement, I would continue this process until the bleeding stops.